BioBalance HealthCast, Episode 86, Laser Skin Treatments.
BioBalance HealthCast features conversations about positive aging, covering treatment and solutions that include bioidentical hormone pellet therapy, safe and affordable skin rejuvenation, and spa-quality botanical skincare. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
We're going to be talking about tattoos and leg veins and hair and
removing
acne.
tattoos. Removing tattoos.
Well, I know you were talking about tattooing lips.
Yeah, cosmetic.
That's
true.
I mean,
cosmetic tattoos.
What we're talking about today is laser treatment, the different kinds of lasers that exist for cosmetic treatments and medical treatments.
That's right.
And specifically the kinds that you have at your office at BioBalance Health.
Well, we tried to have one of everything so that we could meet the needs of our patients. But one of the things patients come in and say, I want that laser thing. Well, there's different kinds of lasers and they all do something different. So it's important to divide them up. I mean, you could come in and say, I want my brown spots removed. That's IPL, or intermittent pulse light. It's a laser, but it is the type of laser that hurts just a little bit when it's being done. It feels like a rubber band snapping against you. And what it does is it finds melanin, you know, the dark area of your skin, but it doesn't take away your tan. So it finds the darker areas that are below your skin that are these brown spots or age spots. They go down to that level, seek them out, and kill the cells.
So the laser goes past the surface of the skin.
Right, it goes
it's
past
set
it.
at a depth.
Right.
So it goes to whatever that
And
depth
that's
is.
true of almost every laser, and that's what makes them different. They use different techniques to get them to different layers of the skin.
Okay.
And that really is one of the big differences in each laser. But IPL lasers hone in on melanin or dark spots, and they kill those cells, and they then come to the surface like any other cell. Your cells start growing at the bottom of the epidermis. They start at the dermis and start coming up, and then they just die and flake off. So these spots are killed, but it takes them about a week or so to come to the surface, and then you kind of look like you've got, I mean, I look like I had a terrible disease.
Because your skin cells die every day, and
Yeah.
that layer of skin falls off. And so
Right.
what it does is, even though the melanin has been killed by the laser,
And it was deep.
it has to work its way to the surface in the normal rotation. And these lasers are target specific.
Yes.
They're not something like in Star Wars where they say, beam me up, Scotty,
No.
this little circle goes over your whole body.
No,
You know,
and they
just
aren't-
find anything that's on it.
That's true. They're not. They've become very specialized. And so this laser itself gets rid of the brown spots, tightens collagen because it's at the same relative area, and then once it peels off, it's gone. So all of those brown spots that you see are potential cancers. Potential if you live long enough, and if they're continually exposed to sunlight, then they can change. So by getting them off your body,
Right.
you're in a much better shape and a lower risk for having skin cancers. Now, you have to make sure that the person doing it realizes the difference between brown spots and a potential cancer. So that, or you go to your dermatologist first and make sure you don't have anything like that, and then get your IPL treatment to remove the benign brown spots.
Okay.
It's now approved for something called actinic keratoses, which is one step closer to cancer. You can use that laser to actually kill that pre-cancer and let it exfoliate off. So that's what IPL laser is, intermittent pulse light. The other laser that is very important for facial resurfacing and rejuvenation is called a pixel or a Fraxel laser, and it goes to a different depth. It's relatively shallow, and it goes down to collagen, and it actually pulls skin in. I mean, it makes skin tighter, and it also fills in wrinkles because wrinkles are damaged. So it goes to the area of the wrinkle, and we concentrate on that when we're using the wand on your face. Usually that doesn't hurt too much while we're doing it. Later, for the next day or two, it can hurt, and there's some downtime. There's like
Hurt like general soreness, or hurt
no,
like
pain.
sharp pain?
And we usually need to give some pain medicine for that night.
Okay.
Or some people are very sensitive. We give them pain medicine that morning that we do it.
So Pixel or Fraxel laser, those are brand names like Oldsmobile and
Right.
Chevrolet?
Yeah, they're names, they're specific names for a similar kind of laser.
So they both do the same thing?
Essentially they do.
All right.
And so it depends on how it's set, how deep we go, and it has a limit. It can't go down to it can't go down really deep where another laser called Q-switch laser goes, but it does the top third of your skin. So that's one of those things that really does change your face. It pulls everything in tighter and it fills in wrinkles, and it's ideal for not getting a facelift. You can have this instead. So
Okay.
this would be something that you could have over and over again once a year, and push your facelift off.
And would it last for a year, the benefits
Yeah,
of it?
they usually, after you've had a series where you've made your face younger again, then you can just have one a year and then keep it up.
Okay.
So that's the Pixel. So if you've ever heard of Pixel or Fraxel, that's essentially, and then very broadly what they do.
And you have both of these?
I have both of these.
Okay.
And then the Q-switch laser, which I'm just now purchasing, goes even deeper than the Pixel, and it goes down to the level of the collagen, and it stimulates collagen, and it doesn't have downtime because it goes so deep. It doesn't go through all the layers and burn them. It goes down to the deepest layer and stimulates those cells. So it invisibly travels through the top layers of your skin and gets down to the collagen, stimulates it, and that does similar things than the Pixel. It doesn't do the surface resurfacing, but it goes deep and fills in wrinkles and pulls your skin in, and it makes it look younger.
It's called a Q-switch
Q-switch laser.
because it switches on the collagen?
It's switch on off basically when we're using it.
Okay.
And I can't tell you more than that because I don't really know all of the science of it yet.
Yeah.
But that's essentially what it does, and that's why we like it, because it does a deeper tightening and a deeper stimulation of collagen.
So which one do you use for hair removal?
We use a different one.
There's another one.
We have an Alma laser, so we have one laser body, and then we have separate heads for all these different things. So we
Okay.
have a different hair removal laser, and that used to be something that was really painful. And now our laser is not, and it does a great job. I mean, it's as good as the most painful hair removal laser you've ever had, but it doesn't hurt. And basically, we can remove hair from anywhere as long as it's dark, and darker than your skin.
Okay.
Because
without
it hones
pain
in.
of the process. So like if you wanted to permanently remove hair from your underarms,
Right.
it wouldn't torture your underarms. You wouldn't
No.
be in pain.
No, you wouldn't. You wouldn't. This is
And
different.
is it a one-time treatment?
No, it's a series of treatments. The hair grows about every 6 weeks. You have a new set of follicles that start growing. So you'd want to do it every 6 weeks. Usually it's about 4 times, sometimes 5, depending on the number of hair follicles, how fast your hair grows. So we try to get each hair follicle as it becomes activated and kill it with this laser. Basically, we're killing hair follicles. And they're at a certain depth in your skin as well. And this hones in on the color of the hair that's in the follicle, and also right at the depth of the bulb of the hair follicle. So it kills the cell that makes the hair.
So the hair doesn't grow back.
Right.
So it's a permanent solution.
Yes, it is.
Once you've gone through the series of treatments.
That's right. It is.
Huh.
So, and we use that on the face because, you know, I do a lot of testosterone replacement, and we get a lot of, we call it hirsutism, but facial hair here and here, and as long as, if it's dark, then we can remove it with a laser. If it's not dark, then we suggest waxing. Don't ever shave your face, girls, because then you get stubble, and it feels like stubble, and it feels like a guy, so no one wants that.
So plucking or waxing.
Plucking, waxing, or lasering.
Or lasering.
And they also have a technique of killing each hair follicle with an electric current. And so that's possible. That's kind of the older treatment for it. But the laser's faster, and the laser does a bigger area, and you don't have to have so many appointments to get that done.
So I've also been reading in the general press about lasers that are used for tattoo removals. I had an uncle who was in the Navy, and he went to the Philippines and got a skunk tattooed on his arm, and now he's a more mature, sophisticated fellow. And he wears like Band-Aids over his arm so that people don't realize how stupid he was.
Well, you know, tattoos are really in, and so many people do tattoos, and then they grow up and they want to have a really responsible job, and they have tattoos in areas they can't cover when they're at work.
Right.
Or they have children and they don't want their children to know they have a bunch of tattoos, so they need to have them removed. Now the black tattoos or the brown or dark color are easier to remove. Some of the pale colors are a little bit more difficult.
The reds and yellows. And
right, but the pale ones, not the deep colors. So we use we take the Q-switch laser, which we were using to stimulate collagen, and we put a different head on it, and it actually is attracted to the ink, and it goes in at the level of the ink, and it basically takes several treatments, and there's more treatments for the darker, the deeper the colors.
Right.
Then we use a series of treatments to get rid of these, spread apart by about 2 weeks.
Okay.
And we can get rid of the laser
So I've
or
seen
the
people
tattoos.
that have like had their tattoos burned off and they're scarred.
Yeah, this doesn't scar you.
That doesn't scar you.
But it's possible that anytime you have a tattoo, you're taking the chance that even if you have it removed, you may not be able to tan in that area. So you may have an area
splotchy.
that's white because it is being taken off with a laser that hones in on pigment. And there's pigment in ink, and there's pigment in skin color.
Right.
So you have to think about that before you have a tattoo. But I don't want to have a bunch of calls about tattoos. I'm not necessarily panning them. I just want people to know that they're permanent, essentially. But if you really want to have them removed, then we can remove them in general, unless they're really
What
pastel.
about like a sleeve tattoo, where somebody's tattooed the entire surface of their skin? I mean,
those can be removed. It just takes a very long time.
And then there's a condition that's not really a tattoo, it's a skin condition called port wine stain.
Right.
Can you treat that as well?
We can treat some of those. It depends on how red they are. We don't have a laser for red. We have a laser for blue and brown that goes to that level, and we can remove some.
They do make those, and
yes,
it could be
they
done.
do make those, and it could be done.
You just don't have that service because you don't have that volume of people with that issue.
That's right. We have some people that have birthmarks, and we take care of the birthmarks, but that's a little bit of a trial and error because you never know exactly how deep the birthmark is.
Yes.
I mean, I've had one young girl, I've used, the IPL comes in 3 different depths for different skin tones. So I've used all of those on her and the pixel, and she still has a little bit of a tint. So I'm planning on using the Q-switch laser on her, and that should get rid of the rest of it.
Okay. So one other topic that I want to ask you about while we have an opportunity to talk about it. My wife's grandmother had a surgical procedure to pull big exploded veins out of her legs. And I've been reading somewhere that there are lasers that now can do that.
That's called vein stripping. And we don't have to do that so much. The key on varicose veins and broken blood vessels are, the bigger they are, if you have really large vessels, you may not be able to do it with a laser. They may have to be surgically tied off, and they tie them up in your groin. In other words, they go in surgically, and usually I send them to vascular surgeons or vein specialists, and they actually use a stitch to tie off the vein, because you know a vein means the blood's coming from your foot back up to your heart.
Right.
Okay, in the lower extremity, and that's where they usually are. So gravity has increased the pressure in the veins. They've lost the valves that usually
they have to push against it.
They have to push against gravity.
Yeah.
And then childbearing
Yes.
is always a risk, because then you have a lot of pressure on the veins as they go through your pelvis, and it blocks blood into your lower extremity, and these veins just expand and explode. So they lose their ability to push back up into the abdominal cavity. Okay. So they have to have something done if you want to wear shorts, and that's a big deal. So if they're really large and there's many of them, oftentimes the surgical approach is the best. But if they're the size of my little finger, then lasers can be put up in there and they can be lasered out or burned. I don't do that procedure, but that is a procedure that is possible, and it works very well. They can just cauterize it from inside the vein, and that's like getting a blood draw, only they're putting the laser up through the vein, and they're finding that area,
that spot,
and then they laser it, and it closes it off, and that's it for the vein. The vein's going to collapse because it can't get back up there. It just stops.
So there are a large variety of laser treatments for different issues.
And we use lasers sometimes for the little ones. For the little veins, the little blue and the little red veins that you get, that women get. I don't know if men, I haven't noticed that men get them that much, but usually it's areas of tension, like around your knee or around your ankle, and you get all these little broken blood vessels, or it's an area of trauma.
What about the alcoholic with the red exploded veins in his face and his nose? Could you treat that with a laser?
Yes, that can be treated with a laser. Wow. And
my dad had that issue.
Yeah. Well, he's going to get more, but I
well,
mean,
no,
he was going to get more if he continued to drink. But we can do that with laser, and we can also do. We can also inject them if they're a little bit larger. Sometimes we inject them with a specific saline concoction, hypertonic saline, and we inject them into these little veins, and they just go away right then. So it's very possible.
Again, those are treatments that you can do because you are a medical spa.
Right. That's right.
Which
can't
we
be done
discussed in a previous podcast, right?
That's
it can't be done just at a regular spa.
That's right. And usually it is done by a doctor or a nurse. So we have a nurse practitioner who does that and is expert in that.
All right. So lasers. We've talked about hair removal. We've talked about acne or acne scars. We have not talked about that.
We use laser treatments for our acne scars, and we can get rid of acne scars with the pixel laser. Pixel is the best one, and Q-switch is also good.
So is that a first response treatment, or is that after they've tried the more traditional acne interventions?
Well, when people have acne, usually they use some kind of medicine or over-the-counter medication on their face to try to get rid of it. And usually you should go through the steps with acne. You should start with the least invasive and go to the most invasive. What we usually deal with acne is we use the jet peel, which we were talking about exfoliates, okay? We also have a specific head for acne that actually puts saline, like flushes the acne, the actual acne, active acne out, and it gets all the bacteria out of it. And it bathes it with saline, and then it allows it to heal. So we're taking the dead skin off the sebaceous gland that is infected, and we're taking that off, opening it up, and putting saline in there, and that cleans out bacteria, it cleans out dead skin, and it's allowed to heal.
So when I think about acne, I usually think about adolescence and developmental issues, but I have a friend who's my age, early 60s, and has had massive acne scarring all his life.
Right.
Would he be a candidate for that? Would that be something that would help him?
That wouldn't be the jet peel. We would use the laser on the scarring. And that goes, we take the laser and it goes down to the level of the scar tissue and it breaks it up, just like it would in a wrinkle. A wrinkle is being pulled down by fibrous tissue. Well, the acne scarring has that. So we use the laser to break up that fibrous tissue below and to let it come back up. And it does work beautifully. We've used that on several of our patients. Usually the pixel or the Q-switch is what we choose to do for acne, unless there's brown spots over the acne, and then we use IPL as well. So acne is different when it's active than when it's scarred, and scarring requires the IPL or Q-switch laser, and when it's not, when it's active, then we have to do something to clean it out, kill bacteria. And so we choose to use jet peel. There are lasers available for just acne, but we think the jet peel works better for less money.
Okay. Well, thank you for listening today, and we hope you'll come back next time.
Thank you very much. We'll see you next week.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. Follow Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth. Brett Newcomb can be found at brettnewcomb.com.